Moyamoya disease is a disease of the blood vessels of the brain, particularly the internal carotid arteries, the main pipe to the front and sides of the brain. And what happens is these blood vessels shrink down and eventually they occlude. And unfortunately, when that happens, patients will present with hemorrhage or a stroke from not getting enough blood flow to the brain.
The reason Moyamoya is Moyamoya, it's Japanese for puff of smoke, because of that compensation. When the brain tries to compensate for the lack of blood for the brain, those compensation vessels, when we look at images, either on MRI scans or on angiograms, it looks like a puff of smoke.
Being diagnosed with Moyamoya disease can be a surprising or traumatic experience for many patients. They can feel isolated and alone. It's a rare condition. Often family physicians have not seen too many patients with this disease, and our goal is to be that resource where they can come to a place that has a vast experience in dealing with these patients and their conditions and navigate them through the whole process of monitoring and the treatment of their disease.
One of the advantages of coming to the Swedish Moyamoya Center is that it's a place to get all-round care. To be there for those patients, no matter whether it requires a surgical expertise, a place to talk to someone, or care from one of our other specialists, either in neurology or one of our imaging experts.
One of the main benefits we have here at Swedish is our neuroimaging capabilities, and particularly with patients with Moyamoya disease, there's quite advanced neuroimaging techniques that we can use to determine how much reserve the brain has, how much cerebrovascular reserve or how much blood flow is going to the brain, and that can help tell us whether patients would be good candidates for revascularization procedures or whether they should be left alone and treated non-surgically.
The surgical treatment of Moyamoya requires us typically to use a blood vessel in the patient's body and use that as a way of augmenting blood flow to the brain. Some of the advantages of coming to the Swedish Moyamoya Center is that you have highly capable surgeons who have done this procedure many, many times. After a successful procedure for Moyamoya, after a successful bypass, patients are very pleased with their outcome because of the difference that they feel. It's often life-changing or life-altering. They just feel like a different person after a procedure like this because of the new blood flow to their brain. They're in great care here at Swedish Medical Center with a multidisciplinary team with people who are really watching out for them at every step of the process, and we're here to guide them through that and help them through it.